Welcome to HealthSphere MD. Prostate cancer is one of the most common cancers men get all over the world. But here's the good news. If you catch it early, it is also one of the most treatable. In this video, we will go through everything you need to know: what the prostate is, how prostate cancer starts, who is more likely to get it, how doctors find it, and what treatments are available today. Maybe you're watching because your test came back abnormal. Maybe someone in your family has been diagnosed, or maybe you just want to learn. Either way, you have come to the right place. Let us start from the beginning. The prostate is a small gland. It is about the size of a walnut. It sits just below the bladder in men. It wraps around the top part of the urethra. That is the tube that carries urine and semen out of the body. What does the prostate do? Its main job is to make seminal fluid. That is the liquid that feeds and carries sperm. When men get older, the prostate often gets bigger on its own. That is called BPH, benign prostatic hyperplasia. It is not cancer. Many men have BPH and get urinary symptoms from it. Prostate cancer is different. That is when cells in the prostate start growing out of control. Most prostate cancers grow very slowly, sometimes so slowly that they never cause any trouble during a man's whole life. So, who is most likely to get prostate cancer? The biggest risk factor is your age. Before 50, prostate cancer is very rare, but after 50, the risk starts going up. Most cases are found in men over 65. Family history matters a lot too. If your father or brother had prostate cancer, your own risk is about double. And there is something else. Men who carry a gene change called BRCA2, the same one linked to breast cancer in women, also have a much higher risk. A big study called the IMPACT trial proved this. It showed that BRCA2 carriers need to start screening as early as age 40. Your ethnic background also plays a role. Men of Black African or Black Caribbean descent have a much higher risk, 2 to 3 times higher than white men. Researchers are still trying to understand why, but the pattern is very clear across many studies. What about food and exercise? A diet high in red meat and processed foods, plus not moving your body much, may add to your risk. But the evidence for that is not as strong as for age and family history. If any of these apply to you, especially being over 50, having a family history, or being Black African or Black Caribbean, you should talk to your doctor about PSA testing. Here is something every man needs to know. Early prostate cancer usually has no symptoms at all. That is why screening is so important. You can have cancer and feel perfectly fine. By the time you notice something wrong, the cancer may have already grown outside the prostate. When symptoms do show up, they usually have to do with urination. Why? Because the prostate sits right next to the bladder and the urethra. So if it grows, it can press on those parts. Watch out for these signs. Needing to pee more often, especially at night. Having trouble starting to pee or stopping. A weak stream of urine that stops and starts. Feeling like your bladder is never completely empty. Blood in your urine or your semen. Now, here's the tricky part. These same symptoms can also come from BPH, which is not cancer. So having these symptoms does not mean you have cancer. But it does mean you need to see a doctor. If the cancer is more advanced, you might have lower back pain that does not go away, pain in your hips or pelvis, or weight loss you cannot explain. Those signs need urgent medical attention. Men come to my clinic and ask me, "Doc, I wake up twice every night to pee. Should I be worried?" I tell them the same thing every time. It is probably not cancer, but we should not just guess. We should check. Here's what I actually see in my practice. Most men who come in with urinary symptoms have BPH, not cancer. The prostate gets bigger with age, it pushes on the urethra, and you get exactly those symptoms. That is reassuring. But here's the problem. Prostate cancer can sit right next to BPH. It causes no symptoms of its own. The BPH makes all the noise. So the man thinks everything is fine. But one does not rule out the other. The men who worry me the most are the ones who ignore their symptoms for years. It is just age, doc, they say. They never get a PSA test. Here's why that matters. Prostate cancer caught at stage 1 or 2 has a survival rate above 99%. Caught at stage 4. When it has spread to the bones, that changes completely. The difference between those two outcomes is often just one blood test and one conversation with a GP. I also want to talk to the men who know something feels different, but are afraid to come in. Maybe you're embarrassed about the exam. Maybe you're scared of what they might find. Maybe you just do not want to make a fuss. I understand all of that. But please think about this. Catching it early is not just about numbers. It is about having choices. At stage 1, you might not even need treatment. At stage 4, your choices are much fewer. Come in, get the test. Let us do the worrying for you. Diagnosing prostate cancer usually starts with a PSA blood test. PSA stands for prostate-specific antigen. It is a protein made by prostate cells. If your PSA level is high, it could be cancer. But it could also be an infection or BPH. So a high PSA alone does not mean you have cancer. But it means the doctor needs to look further. Your doctor may also do a digital rectal exam, feeling the prostate with a finger to check for any hard or uneven areas. If these first tests show something worrying, the next step is usually an MRI scan of the prostate. This gives a detailed picture and helps find any suspicious spots. Why MRI first? A big study called the PROMIS trial, published in The Lancet in 2017, showed that using MRI before biopsy finds more serious cancers and also reduces unnecessary biopsies by about 27%. Because of this study, guidelines in the UK and Europe now say MRI should come first. If the MRI shows a suspicious area, the doctor does a biopsy. That means taking small pieces of tissue from the prostate and looking at them under a microscope. If cancer is found, it gets a Gleason score, a number from 1 to 10. The higher the number, the more aggressive the cancer. Then doctors do staging, figuring out how far the cancer has spread. Stage 1, the cancer is still completely inside the prostate. Stage 4, the cancer has spread to other parts of the body. Knowing the stage and the Gleason score helps the doctor choose the right treatment. The good news is that prostate cancer has many good treatments. The choice depends on your age, your overall health, and how advanced the cancer is. Active surveillance. If the cancer is slow-growing and low risk, you may not need treatment right away. Active surveillance means watching it closely. Regular PSA tests, regular checkups, and occasional biopsies. You only treat it if it starts to grow. The Prostate trial, published in NEJM in 2016, with 15-year follow-up in 2023, compared active surveillance, surgery, and radiotherapy. It found that all three had the same survival rates for low-risk cancer. So active surveillance is not doing nothing. It is a real, evidence-based choice. Many men stay on it for years without needing treatments. Surgery, a radical prostatectomy, removes the whole prostate gland. These days, many are done with robotic assistance, which makes recovery faster and more precise. Surgery is often recommended for younger men whose cancer is still only in the prostate. Radiotherapy, radiation can come from outside the body. A machine aims beams at the prostate. Or it can come from inside. Small radioactive seeds placed directly into the prostate. This is called brachytherapy. Both work very well for cancer that has not spread. Hormone therapy. Prostate cancer cells often need testosterone to grow. Hormone therapy, also called ADT, androgen deprivation therapy, lowers testosterone levels to slow the cancer down. It is often used together with other treatments. Chemotherapy and targeted therapy for more advanced cancer. Chemotherapy or newer targeted drugs may be used. Sometimes alongside hormone therapy. Sometimes after other treatments stop working. Every treatment has possible side effects. Your doctor will help you choose the one that gives you the best balance between effectiveness and quality of life. Let us talk about what happens after diagnosis. The picture for prostate cancer is genuinely hopeful. If you are diagnosed at stage 1 or stage 2, meaning the cancer is still only in the prostate, the 5-year survival rate is over 99%. That means almost every man diagnosed at that stage is alive 5 years later. Many live completely normal lives, even at stage 3, where the cancer has grown outside the prostate but not spread to faraway organs. The 5-year survival rate is still very high, about 98%. At stage 4, when the cancer has spread to bones or other organs, treatment is harder. But even then, treatments have improved a lot in recent years. Many men with advanced prostate cancer live for many years with a good quality of life. The main message is this: early detection saves lives. The earlier you find it, the more treatment options you have, and the better your chances. Getting a prostate cancer diagnosis can feel like the world is crashing down, but for many men, it becomes something they manage, not something that controls their life. Treatment can have side effects. Problems with urination, problems with sexual function, feeling very tired. These are real, and you should not just suffer in silence. Talk to your medical team. There are specialists, physiotherapists, continence nurses, sexual health counselors, who are trained to help men exactly with these issues. Your mental health matters too. Feeling anxious, depressed, or just lost after a cancer diagnosis is completely normal. Talking to your GP, a counselor, or joining a support group can make a huge difference. Support groups, in person or online, connect you with other men going through the same thing. Many men say hearing from others who have been through treatment and are now living well is one of the most helpful things. Lifestyle changes also help. Regular exercise. A balanced diet, staying at a healthy weight, not smoking. All of these have been shown to improve both survival and quality of life for men with prostate cancer. Prostate cancer is common, but it is also one of the most manageable cancers if you catch it early. Here's what I want you to remember from this video. Know your risk. If you're over 50 or you have a family history of prostate cancer, or you're a Black African or Black Caribbean man, or you carry a BRCA2 mutation, talk to your doctor about PSA testing. Do not wait for symptoms. Do not ignore symptoms. Changes in urination, blood in your urine. Unexplained pain, see a doctor. Most of the time it will be something harmless, but it is always worth checking. Ask questions if you or someone you love has been diagnosed. Ask your doctor about all the treatment options, including active surveillance. You're not alone. There is support out there. From your medical team, from charities, from other men who know exactly what you're going through. If this video helped you, please like it and subscribe. We are making more guides on cancer types, screening, and treatment as part of our cancer awareness series. Thank you for watching. Take care of yourself.